He went and just had some blood tests, and at that stage we were all thinking that it would just be a general viral illness. They weren't sure what type of leukaemia he had, but they anticipated we would be an inpatient in hospital for roughly about a month. Within about a 24-hour period, Glen had a Hickman's line inserted and chemotherapy had been started. It seemed like every infection that Glen could get, he got, and the worst of them. Then he got the MRSA bacteremia.
We believe that the majority of catheter-related bloodstream infections are preventable. In fact, in centres that stick to the best practice guidelines, they have rates approaching zero.
I got a phone call from his mum saying that they'd had a Met call on him and he was dropping his blood pressure and he was going off to ICU with this MRSA bacteremia. I guess you have times where you see him really, really unwell and you think that, you know, he's going to be okay. He has to be okay. He has to just keep fighting it.
Preventing catheter-related bloodstream infections in the healthcare setting is everyone's business. So clearly the people who are inserting the lines, through the people who are managing the lines on a daily basis, teams that are involved in consulting on patients are involved, but the managers in the critical care areas and in the rest of the hospital are also involved. But most importantly, the CEOs and Board of Management needs to take this on as an absolute priority as well.
And I do remember the day that the haematologist walked in and said that Glen had his neutrophils back, that his immune system was coming back, and he was still here with us, and that was just like, you know, the biggest blessing, like she was coming to tell us the news that we'd been waiting for.
It's quite incredible that I survived, and certainly I treasure life at this stage. I really have no long-lasting side effects as a result of my inpatient stays, so despite those complications, I've come out fit and fighting at the other end.
Look, there's an ancient dictum in medicine that first we should do no harm. I think sometimes as clinicians, doctors and nurses, we forget when we're concentrating on the problem at hand in front of us, that actually what we regard as relatively minor things like hand hygiene or aseptic technique, if not observed, may have devastating consequences for the patient and their family down the track.
I think it's really important to recognise that wholeheartedly we are there to advocate for patients and advocate for the best care for patients. And having dealt with that, you know, firsthand as a personal experience, I feel that I try and make that the most important thing in my job.